Scott, Olivia, and Brad. Thanks for watching Good Day Arizona on 3TV, Arizona's Family.
Hey, welcome back, everybody. How many times have you got out of bed or maybe lifted up some groceries and thought, oh, my back, there it goes again? Well, this guy can help you out. It's Dr. John Komar from Southwest Spine and Sports, and you are a physiatrist, which I had never heard of before today, so thanks for coming on.
Thank you. Thanks. That's the correct way to say it, physiatrist. We try not to say physiatrist because that sounds too much like psychiatrist.
Right.
And you know, Scott, we're kind of like the Rodney Dangerfield of medicine. There's just not enough people who know about what we do and what we're able to help out with. And as a physiatrist, physical medicine and rehabilitation is our specialty, and really we are function doctors. We are meant to help get you back to your activity, whatever, sports, running, by all means that we can use without the needs of surgery. So we have lots of tools in our arsenal to do that. So
How is it different from a chiropractor?
Chiropractor is more of a passive mode of therapy, of someone doing things to your back for you. We're on the more of the active side. We're going to teach you better body mechanics, better ways to use your back, and plus other means we can help speed up your recovery, and things like, you know, the epidural injection, other type of medications.
Seems like the older you get, the more prone you are to back injuries, but
Sure.
I have so many friends that have sore backs or have hurt their backs, and like we mentioned during the break, you can sneeze. It doesn't take a lot.
Doesn't take much at all. Yeah, and back problems are the #2 reason to see your primary care doctor, second only to the cold. So very, very common. But the good news is a lot of times you can get better without surgery. And there are a lot of things we can do, like certain medications that can help quite a bit, anti-inflammatory medicines. There's even new nerve-type medicines that are pain medicines without narcotics. Physical therapy is certainly a big part of rehabilitation. It's a lot of not only education for how to bend and lift and, you know, pick up things better, but also exercise that can be very appropriate. Exercise that will hopefully get you back into, you know, if you want to run, walk, play with the kids, whatever you want to be able to do.
What if I hurt my back on the golf course and I came in to see you? Like, what kinds of things would we do?
Oh, yeah, yeah. So our goal is to do very comprehensive evaluations. So I would say about 90% of the time, I'm going to be able to get a diagnosis just by your history and a good physical examination. The other things we can use, like a nerve test and MRI, they're basically like an extension of my examination. And you'll see the picture that we have up here. This is what an MRI looks like. An X-ray can't show me this. This is showing me actually what the disc looks like, and that arrow is pointing right to that pooch. And that's sitting right on top of the nerve that goes down your leg.
I see.
So this can be very helpful as far as nailing down the diagnosis too.
All right. Do we have some other graphics, I believe?
Yeah,
Yes, we do.
and in addition, now the old-fashioned way of doing epidural injections for treatment of low back pain was patient leans over on a table and we just kind of shove a needle up your back and hope that it gets there. But even the hands of an expert, yeah.
Doesn't sound very scientific.
No, and 30% of the time you're going to miss too. So this is all under X-ray guidance. This is using X-ray technology, so I know exactly where the needle is going, no guesswork. We use contrast, that's what you see there, the black stuff, and so we can place the medicine right where it counts.
Is that something you want to do at last-ditch effort to...
This is after you've tried medications and physical therapy,
Right.
but this is all means that we can use before surgery.
Right,
Yeah.
okay. Well, Dr. Komar is with Southwest Spine and Sports, as we mentioned. You have locations in Scottsdale and Tempe.
That's right.
And so we'll have all the information on our hotline. There's the phone number, and azfamily.com. So hopefully if you're sitting at home and you have some back problems and you haven't been able to find the answer, maybe Dr. Komar can help. Thank you for coming down. We appreciate that. Sometimes I pull a back muscle just reading these scripts. You know, some of these words can be really big.
I'll give you my card.
All right, still to come, the importance of detox and how you can help renew your own system. But before that, we're going to get you caught up with some out-of-the-ordinary news. Activism is apparently not just for the young, but could these senior citizens be barking up the wrong trees? Plus, you're not going to believe this one. A pastor gives a rabbi the gift of life, showing how compassion can reach past any boundary if you give from within. All this coming up right after the break.
If you're